we are just a brief announcement from the LACC. We're trying to get to at least 100 subscribers on our YouTube channel. We have 50, and we can have access to some customization options provided by YouTube. When we get to 100, then would appreciate your support for the LACC. Please go, if you after the this community conversation today, go to your YouTube channel link, and I think either Marie or Joe will put that in the chat box, and click on the subscribe button to subscribe to our channel.
Kim has already put it in the chat, David. So
okay, great. I'm now going to introduce our guest speakers and ask them to give a brief overview of their businesses. Please hold your questions until I open it up at the end of the panel discussion for questions from the audience. Richard Draeger, co-owner of the Draeger's Markets.
Yes, we are again a third generation operated business. We were founded in 1925. So we are 97 years old, believe it or not. And we started as a small company in San Francisco. My grandfather was issued the first liquor license, in fact, by the city of San Francisco when Prohibition ended. We came down the peninsula after World War II as a company, and my father brought in products from around the world because the Stanford alum, they traveled so extensively. They were very, very familiar with those types of products. And we became a specialty grocery provider over the years. And as a third generation, we brought in bakery products, and we brought in a few more stores. So now we're a 4-store company, and we operate in Danville, Menlo Park, San Mateo, and of course in Los Altos. And it's a rare thing, in fact, in the sense that a small company like our own in the grocery industry doesn't exist in very many other places of the country, believe it or not, just because it's such a high cost, low margin business. But it's one of the reasons why, other than the fact that I have such a great relationship with Kim, that I wanted to join this morning, because our biggest input after purchasing is labor.
Well, thanks very much, for attending, and also for what you and the Draeger store has always done for our community. It's been an integral part of what all of us, who live and work in Los Altos have in our lives. So thank you. Duanni Hurd.
I'm Duanni, and I'm the president, CEO, and the co-founder of Starlight Caregivers. Starlight Caregivers is in its 10th year in business as a licensed home care organization under the Department of Social Services of California. The business was founded in 2013 with our first office in Palo Alto, then relocated to Los Altos in 2016. Our office is located on the second floor of the 2-story building next to the storied and famed restaurant Chef Juice we all know. Personally, I'm a licensed home care organization administrator in the state of California and a nationally certified aging life care manager, formerly called geriatric care manager. I'm also a certified administrator in California for residential care facilities for elderly and adult residential facilities for the developmentally disabled. Our employees are experienced caregivers, companions, certified nursing assistants, home health aides, medical assistants, and licensed nurses. We not only work with clients in private homes, but also in many Bay Area care facilities to provide one-on-one care by providing home care and care management services. Local hospitals, senior centers, aging life care managers, nursing homes, independent living facilities, and assisted living facilities oftentimes call us to provide services to their patients or clients. Home health agencies and hospice agencies also refer clients to us to provide home care services to supplement their Medicare authorized skilled nursing services. Now, home care services include daily living assistance, post-surgery care, medical escort, and special care services, including, for example, dementia care and Parkinson's care. Care management services are provided by care managers managing all aspects of care, including medical appointments, care coordination, hiring, and management of household personnel. The role of a care manager is similar to an adult son or daughter that is responsible for clients' living arrangements. We have provided services of over 300,000 hours and 650 clients during the past 9.5 years, including many members in this very tight-knit Los Altos community. Our clients range in any age, from babies to over 100 years old. We service clients mainly in Santa Clara County and San Mateo County, as well as providing traveling care services for clients going to other states or overseas. We have also run placement services with caregivers and nurses in the other states. Navigating home care service can be very challenging for all, which peaked during the pandemic. And the demand for services have been higher than ever. It is very meaningful to be here as a panelist in this community conversation that is focused on local affordable housing needs for the essential workers, because housing is an essential factor in hiring and retaining employees. I'm looking forward to the discussion.
Thanks, Duanni, and thanks for what your organization does for our community. First question, to what extent does the inability to find affordable housing in the area, in your opinion, to what extent does that affect your ability to attract, hire, and retain staff? I'll start with Richard.
Well, it has a significant impact. And in fact, what's been going on through COVID is we have had a flight of labor from the Bay Area, especially in our demographic, our labor demographic, to other areas of the country that are more affordable. And we do not see that reversing. And in fact, we see it probably accelerating. We believe that the housing issue has been a supply issue. And it's been a supply issue for 25, 30 years at least. In my history, when I started in our business, our employees were able to find homes in Mountain View, Cupertino, all of these areas surrounding our store in Los Altos. In fact, I'll speak specifically to Los Altos. This is going on, of course, throughout the company, but still, I'll keep it specific to Los Altos as much as possible. But at the end of the day, these homes in the local area are far beyond the ability of our employees to afford. And the typical employee either lives 2 or 3 families to a household if they're going to live anywhere locally, or they, believe it or not, will drive as far as Tracy, Manteca, areas in the Central Valley for their housing. And what's been going on, of course, as the Central Valley's economy has improved, they've decided not to take this trip. Beyond that, with the price of gasoline, the economics for them to be making these long trips has become really more and more untenable. But again, to revisit where I started, this is a supply issue. And we have seen a dramatic shift through state law and state regulation in the ability of a developer to finally start building local housing. So I've done just a personal survey of my own, just driving up and down El Camino Real, as far north as Millbrae, and as far south as Mountain View. I did this with my wife a few weeks ago, and we were astounded, to be honest with you, at the number, literally thousands of housing units finally being built locally. So this supply-demand imbalance is absolutely being positively affected finally and I believe in a very good way. But this has got a huge impact, of course, on our employees.
Thanks, Richard. Duanni.
Thanks, David, and thanks, Richard. Affordable housing is essential in the challenge of hiring and retaining employees. Majority of our employees fall into the very low income to low income categories, which is 50 to 80% of the Bay Area median income level. And they live in East Bay or deep into San Jose, and routinely take 45 minutes to 1 hour or even 1.5 hours to commute. Long commute time drastically increase gas price, and even the bridge tolls of Dumbarton Bridge and Summit Hill Bridge are impacting factors to affordable commute. To be able to work in our very expensive service areas, flexibility of work time and affordable commute costs are key factors. However, our client service needs are not flexible at times as aging adults and patients, which makes local affordable and available housing even more desirable. At Starlight, we have both office staff and field workers, both of which are traveling long distance to the office and our clients' homes. I have lost key office staff that simply could not commute that far anymore, as it's long and stressful and tiring. A key office employee that has been with us in business for over 7 years lived in Hayward until she got pregnant and moved to Modesto to be able to afford that house for her growing family for that exact reason. Her husband works for Tesla, which provides an employee shuttle to transport employees living in Modesto on a daily basis. But as a small business, we're unable to provide such transportation support. Field workers are reluctant to commute to Los Altos because of traffic and the rising cost of gas expenses. They prefer to work 8 to 12 hour shifts to maximize one commute. And this has oftentimes resulted in huge struggle to fulfill shorter service needs that is less than 8 hours per visit. We have managed to fulfill all of them, but staff consistency is by no means guaranteed, and a revolving door situation with caregiver turnover for short service needs. That is a struggle in turn for our clients.
Thanks. And, you've both confirmed what one of the reasons the state and so many of the citizens are very concerned about affordable and available housing. An allied question is, what has the last 2 years been like for you and your business in terms of this, and how does that compare with pre-COVID times? I think you've touched on it, but somewhat, but Richard, give us your thoughts on the difference between pre and COVID times.
Well, it's never been like this. Just to start, this is absolute insanity. What we dealt with at first was that as all of these service businesses shut down, such as restaurants, bars, we had an availability of staff. And we were able to scale up because we were the only source, frankly, for food. So restaurants had gone away, institutional food such as Facebook, Google, et cetera, which, believe it or not, do feed quite a few folks that are part of our customer base. They had all shut down. So we were the only place food could be purchased. The hoarding of products, everybody has read this in the paper. It was alive and well, and they were buying things that they hadn't bought for years because there were only things left on the shelves, believe it or not. So at least out of the gate, the labor issue was solvable. Now it's flipped. Things are normalizing. Other businesses are starting back up, especially, say, restaurants. Folks that had come from the restaurant industry to work at our company They wanted to go back to things that they were familiar with, so they left to go back to restaurants. But the other part of this that's been going on is this incredible amount of inflation has really put an exclamation point on they're looking around for other things, because the Bay Area, even though it has perhaps impacted the least of the major metropolitan areas in the United States when it comes to the escalation of pricing, that's only because it was at such a high base to begin with. And so this inflation has put a lot of these folks that were on the margin out the door. And it's become the biggest staffing struggle we've ever had historically. We have never been through anything like what we're experiencing right now. So this COVID effect, very honestly, if this trend continues, and I believe the job openings ratios are going to be changing dramatically. That's just my own personal economic belief over the next couple of months. If it stays at the level that it's at, it's going to force automation because it's either you bring in some kind of technology to make up for these labor shortages, or you curtail hours and services, or frankly, just give up the fight and you decide to do something else. But that is really what we're struggling with right now as a result of COVID.
Duanni.
I resonate so much with what Richard just said. And first, of course, this pandemic has been extremely difficult, as our business has lost 25% employees, and Starlight had 130 plus active employees, including the 9 office staff pre-pandemic. Post-pandemic, or through the pandemic, we lost 25% of the staff. Now we have 100 employees, including the 8 office staff. The demand for services has far exceeded the ability of personnel availability. Our business relies on caregivers delivering quality care for a variety of vulnerable elderly and disabled clients in our community. We can easily hire back the 25% of lost employees and put them back to work right away. And first, this will help with reduce very high overtime costs we're forced to apply, and in turn, we have increased the service fees to the clients. So the clients are forced, some of them are forced to abandon their desire to age at home and move to facilities, which cost 25% to 50% less. And second, more employees mean more service supplies to meet the demand of short service hours. That is very highly desirable, less than 8 hours per visit. And also means better consistency of the caregivers for the same client. The elderly, the disabled, and especially the ones with memory issues such as dementia, revolving doors of caregivers and low consistency is highly challenging for them. As an essential business during this pandemic, we doubled down on all the safety protocol and have strived to prepare our caregivers with confidence to enter clients' homes. This, of course, came with challenges when both clients and our staff came down with COVID. This demand, however, despite the COVID, the fear of COVID, the fear of infections, the fear of infection spreading is still higher. But the supply has become even lower with caregivers having to go through quarantine. We thought the pandemic was over. However, we frequently hear and experience the bouts despite boosters, second, third ones, you name it. We're still seeing this COVID in our communities and spreading, and continue to provide challenges when it comes to quarantine needs, isolation needs for both the clients and caregivers. And the pandemic has also resulted in tech workers working from home who have some leverage to provide limited care to their loved ones, but they still need services. Compared to the pandemic, pre-pandemic, these service hours are usually shorter, which is less desirable for the caregivers who want to maximize one commute and work for 8 to 12-hour shifts. Now you see the conflict here we're experiencing. In a way, the government monetary benefit has made the situation more challenging as the workforce in general across numerous business markets opted to stay at home at some time during the height of the pandemic. Now, the drastically increased gas price has further limited employees' availability and ability to drive to the expensive areas such as our town, Los Altos, or our city of Los Altos, and the surrounding cities. Now, Richard also brought this up, and it's impacted us as well. The high inflation is another very negative factor for our business. This is the first year in our 10 years history that we have had to raise the billing fees in mid-year so we can afford to pay our employees more to accommodate the cost of living increase. In all previous 9.5 years, we had only once a year service fee increase at the end of the year to accommodate the cost of living increases. Our billing fee increase was limited to certain clients. Not all the clients, they're having our 24/7 services, but still, we have to increase the pay to our employees, and it just left us with no choice. It's a huge struggle.
Thanks to you both for your answers and the detailed explanation of how tough and challenging a time it's been. Moving on to the next question, I'll start with Duanni on this. Do you have any ideas about what federal, state, or local governments could do to resolve the affordable housing problem? Thank
you, David. Practically, there are things that I think they may be able to do, immediately or in a short time period. Very practically, maybe open up express lanes on the freeway and making them more affordable to our employees' affordability. Mass transit is unrealistic in our world right now, but reduced bridge tolls could help.
Yeah, thank you.
Yeah, and of course, we're looking forward to the new homes and condos being approved citywide in Los Altos. And I was crunching numbers, and I have crunched numbers. I was wishing and hoping that they would make a significant difference in our working world. But on the other hand, I'm looking at all the services industries across the board. I'm thinking, are these numbers making any difference to us, real differences? And the small amount of less costly housing units that have been promised seem to be out of reach, and my key office employee, that one of them lives in Oakland. I mean, she commutes daily, and that's easily an hour to an hour and a half commute each way. And she's frequently late in the morning. She has to take care of her school-age children first, and there are 2 of them. She works extremely hard. All I have is appreciation and hoping that she would continue to stay with us. She has applied for affordable housing, and my office manager has supported her in that initiative. And her name and her family's names have been put on affordable housing wait list at different sites across from San Jose, Mountainville, different places. And we're not even sure, honestly, when to apply for the Los Altos housing. And I looked across, and it says that you apply at some point, and not exactly sure, and how long that wait list could be. I mean, are essential workers being prioritized on the wait list when it comes to access to Los Altos affordable housing? And I have many questions, but my hope is there. And also, the big tech companies, and should they step up and focus on housing for the community, not just their own employees? Google, for example, I mean, once they offered to build mass housing and the key tram over 101 to Caltrain, and they seem to have ended up with Google housing only and a taxpayer-funded school for their employees. I mean, what about the rest of the service population that are in existence to service their employees, their families of the employees, and their mere existence, that's, having a huge business in our community. So that's just some thoughts I have.
Thank you. Richard, I'll bounce it back to you.
Yeah, well, my heart goes out to you, Duanni, because this is the toughest thing to figure out as far as I'm concerned. I think that the state regulations have helped dramatically. I do think that this not in my backyard mentality, frankly, has pretty much been overturned as a result of regulation. I think that it could be improved quite a bit, though, because essential workers, of course, fire and police, but our workers are essential too. We sell food, and obviously Duanni's got very crucial care workers. So at the end of the day, our attitudes have to be more broad in who is essential and how do we solve this problem. Solving a problem for an engineer that's making $175,000 to $300,000+ a year is an easy thing to solve. Solving for folks that are making anywhere, say, from $40,000 to $75,000 a year is really what we're challenged with right now as a community. And I think that some of what has been going on relative to, say, Woodside, Los Altos Hills, Portola Valley, these housing requirements, they are being fought with very, very expensive legal representation, and for many very valid reasons. I believe that it does change the character of some of those communities, but there's a very simple solution in my mind. Let these folks purchase credits. Those credits, of course, could apply to areas where these service labor shortages are so acute. They are most acute in areas like Los Altos, Menlo Park. I mean, you can pick your communities up and down the peninsula. Any one of these cities that I'm naming are where those credits could be applied and would make a much more economic proposition for the development community. And at the end of the day, trying to just have a below market unit available with all of the surrounding regulation. Most of us understand how these regulations are gamed by folks that are, in fact, are not, they are not low income folks. They are just folks that, in fact, are pretty darn smart, and they are able to get a low cost housing unit, and they don't deserve one. So there's an awful lot of regulation that needs to be rewritten, just in fact to prevent this type of gaming from going on. Beyond that, I'd say that the development community are the ones that build these homes. If they don't have a 5% or 10% return, given the amount of risk that they're taking with their capital, this problem will never be solved. So I think as a group, we have to understand that this is a private-public partnering that's got to go on. And the private, honestly, are the ones that are going to finally solve this, but it's only going to be solved because the public understands that they're not the enemy, they are indeed the solution for this.
Thanks, Richard. I'm now going to open it up to questions from the audience. And if people could raise their virtual hands using the reaction button when they have questions, I'll facilitate the Q&A. Everyone's always so shy at the beginning of there we go. Kim Cranston.
Thank you. I think Ann actually had her hand up before me, but it's kind of over in a very light area, so hard to see. But anyway, I'm curious for both of our presenters today. Have you come up? I'm sure you've been experimenting with creative solutions to hiring despite the lack of housing. Have you found any things that work in terms of recruiting and retaining people? That's been part of your experimentation of how to survive these very strange and challenging times.
There you go, Duanni.
Well, thanks, Richard. We, in our line of work, in our home care industry, and we're very creative, Kim, and innovate that because the needs from our clients are really all over the places, right? And you have one family, one client that could be asking for the daytime hours, starting from 10 o'clock and until 2 o'clock in the middle of the day. And you could have clients asking from 11 p.m., until 5 a.m. And because that's, the peak of their service needs. So we're constantly with the chess play in the office, right? And that's what the office staff do 24/7 is to figuring out this puzzle, how to match our employees' availability and with the client's needs. And so it's a constant chess play. The biggest, how to say that, thing we can offer to our employees is flexibility. And because many employees are women and they have children and they're in the middle of the sandwich generation. I mean, they're the sandwich generation and they have to care for their aging parents and young children. And but maybe comparing to Richard's business, and you got to be there at certain time to service their clients in the stores, but we have some room to go, right? And but again, as I pointed out earlier, that our clients demands consistency, and they prefer and they deserve consistency, which is a huge challenge when we're just able to feel who's available. Okay, of course they're all qualified and highly skilled, but let's put them there, right? So there's no consistency that's provided. And I guess with all that said, as creative as we can be, and the results has been limited, and we need folks to work, and our aging and sick population need folks to be there to care for them, and it's just a huge struggle.
Richard.
Yeah, so we just signed a CBA, a collective bargaining agreement that for the upcoming 3 years, that within 18 months increases labor by over 17.5%. So what you're seeing right now with inflation is becoming embedded. So expect that to continue. So in terms of securing labor, number one, the thing that we've offered is a $500 bonus as for a referral to any of our staff that refer one of their associates. And then there's a follow-on $500 bonus at a 6-month time frame if that new associate has started and in fact remained with the company. So it's an overall $1,000 bonus for referrals. Beyond that, what we are in fact experiencing is the same thing that any of you experience in your own businesses, is that your best employees are in fact the ones that bring the best employees. So if you can really focus on just bringing in great key people at much higher cost, it's one of those things, it really does build your organization down the road. And one of the things that we're having to struggle with, we were able to make some accommodations early on in COVID for earlier hours and more weekday hours. Everybody wants to work 9 to 5, Monday through Thursday. But in a service business, it's based upon when the customer is in the store. It's that simple. So we had this curtailment of office hours that was going on at most of our surrounding businesses. And customers were calling it in, just like we are right here. So the point is they were able to shop earlier in the day, be done by, believe it or not, 5 or 5:30, and they were able to get it done Monday through Friday, and generally speaking, Monday through Thursday. So if we concentrated our employees' hours during those same times, it was a wonderful perk for those employees, because in our business, they were used to working as late as 10 p.m., Saturdays and Sundays, of course. But now we're in this position of normalization. So what does that imply? Well, more and more of us are back in the office. As a result of being back in the office, we have to shop after our office times are up, and therefore we're shopping at 5:30 and 7:30. So that perk that we were able to offer our staff is gone. And after all of this struggle for this staff, these folks are saints, seriously. For 2 years being on the front line, really taking all the risk and getting sick. And now we're in this position of saying, well, guess what? Now you have to work later in the day and you have to work weekends. It's awful. But anyway, that's literally how do you retain staff, David? That's what we have to do. It's the referral bonuses, and it's really listening to our best employees, and it's being present in your business. I have to be in my stores, be as fraternal as I possibly can with all of my staff, because what you get in an office is so filtered that if you're not there with your staff, listening to them, asking them day in, day out, hey, how are things working? What's going on? These connections to other folks that they happen to know that very well could be interested in working in your business, they never get sent up the chain of command. It just is just the way life is. I hate to say it.
Thanks, Richard. Ann Paulson.
Hi, I'm really finding this helpful to hear from employers of low-wage employees. And I'm wondering about this idea of buying off one's RENA obligation, which it sounds like a good idea, but I can't understand how the math would work. Because let's say you're Woodside, you have 150, you're supposed to have 150 below market units. It costs $1 million to build one of those units. So I don't know that Woodside has $150 million to hand to some other city to build them. I sort of don't understand how how it's just so expensive to build that it doesn't seem like they're Woodside would be able to afford what the other city would want to do this, considering that the other city also has their own RENA to deal with. So I just wonder how that would work. Anyway, thanks for all these comments. They're really helpful.
Thanks, Ann. I'm gonna, Richard, you're on deck because you presented that.
Yeah, so the town of Woodside has for years been able to buy credits from the city of Redwood City. This planning cycle, this 7-year planning cycle for the general plan does not allow that any longer. So I don't know what occurred relative to the state regs, but the fact is that something has changed that disallows this. And now Woodside, Portola Valley, Los Altos Hills are charged with doing this within their own jurisdiction. And so whatever was changed, in my mind, could be, of course, changed to the way it used to be, where this money, we absolutely spent money, and the city of Redwood City very gladly accepted it just for this purpose. But now what's going on is folks in these same communities, and by the way, these are just the communities that I'm familiar with. This is going on across the country right now. They're digging in their heels and they're fighting this with the best legal representation that they can. And they're just creating really a stalemate in regard to having these things resolved. And who loses? Well, this housing, honestly, it could have also been added to the Redwood City, Menlo Park, all of this stock, in other words, along the transportation corridors.
Duanni, anything to add on to that?
I concur with Richard. I actually, when it comes to how the credit works, and I'm familiar with them, but for my employees that we have applied, we have supported them to apply in the surrounding cities from San Jose and all the way up to Los Altos and Redwood City. And I thought we could have done that because our services actually covers Santa Clara County and San Mateo counties. And my employee that lives in Oakland has done that. You know, she applied for to 5 places. And I have an employee that lives in Fairfield, and he commutes to come to work, and then he rents with roommates locally until he finishes 60 to 80 hours of work, and then he goes home. And I have one employee that lives in Los Banos and who was able to share housing in San Jose with her son and to work with our clients in the San Jose area until her son and family moved to Texas. And so these stories are not stories, you know, they're just real life experiences. And we applied, but still, you know, we've been on numerous waiting lists. I hope the credits works, but I think Anne said, no, the state has taken them away. So I don't know without that, how my employees would ever have a hope. And waiting in line, I hope here in Los Altos then.
Thanks. Marie Young.
Sorry, muted. If Ginny or Larry want to go first, that's fine with me.
Yeah, I was just going in order of hands up.
No,
but,
I appreciate that. but-
Ginny, Larry.
Okay, I'll go. At various times, Draeger's has been listed in the housing inventory. Can you comment on, are you thinking of building affordable housing or any housing on your property?
No, at one point we had a developer approach us and ask us whether or not we'd be interested in redevelopment where we had a mixed use with retail on the ground level. And we didn't really let that progress too far because of the fact that we'd be dark for such a long period of time. We were very afraid that not only was it unaffordable, but it would have meant that a lot of our existing patronage would have established new shopping habits. And that was the reason for that, Larry.
Thank you.
Thanks. Ginny Lear. Ginny, please unmute.
I lowered my hand instead of unmuting.
Oh.
Richard, I'm more experienced with your store as a regular shopper and your employees. So this is something that I think about with them. And when you mention your higher, longer serving employees, and that's what I noticed, that the younger people are there sometimes and then they're gone, but that's sometimes typical of a young person working at a grocery store. But it's very important the way they're trained and at Draeger's and the service and that sort of thing. And so it's a challenge, not only for what you do for the employees working with the customers and knowing your stock and all that sort of thing in the changing times of the economy, but where they live is just seems out of your control. I mean, in Duanni too. And I just wonder how you talk to them to come and work for you in general. How are you down? Maybe you said this at the beginning, but you have fewer employees. It doesn't seem like that, but how is the staffing?
Well, the staffing right now is in fact adequate, but we have had a lot of key folks, the most experienced, in fact, leave. And it creates a very, very challenging business because of the fact that we depend on that experience for, really creating this relationship with a customer. And you cannot just simply have somebody who's been on board for, say, 6 months, 2 years, establish that same relationship with a customer. They frankly just don't have enough knowledge. It takes years and years to accumulate that knowledge. The other thing that has been going on throughout my lifetime in this business is that our business had been a career when I was young. Mm-hmm. And it was a career because of this wonderful relationship that people enjoyed as employees with their customers. And they had a home that was in Sunnyvale or Mountain View, just as an example. Today, these older folks, if they were fortunate enough to invest early on in their lives for a piece of property, they're the outlier. Hate to say it. The young folks, guess what? No chance in God's earth of them owning a home as a result of being involved in our business. And it's really something that I'm not proud of. But let's say that every employee that worked at our company were paid the $200,000 to $350,000 a year that it takes to buy a home in the local area. I mean, to be an owner, okay, not lease, not rent, literally own that home. Now you can understand what goes on, of course, if that were to be the case at Draeger's, to pricing. It would, in fact, just literally close the company. So this is the proposition that we live with, and it's unfortunate. But the young folks, they understand that they're not going to buy a home in our industry, and it's a stepping stone to becoming an engineer at Google.
Duanni, I think you've already answered that question in terms of how difficult it's been to keep your key employees and all the way down the line. Anything you'd wanted to possibly add?
Yes, David. Well, thanks for asking. And thanks, Jeannie, for that question. And I do have two folds of situation with this. One is our long-term serving employees, and we've been in business for almost 10 years. And so we have had a number of employees that have been with us for that long. And however, in what we do, and aging is a factor. Now it's been 10 years. I have a number of employees that have been with me for anywhere from 7 to 10 years. And caring for clients, robots can't replace them. Their emotional support and physical support. And however, an aging workforce does not really help with a lot of service needs and care duties that we need to carry out when it comes to physical support. And they have bad backs, bad knees, and that just comes naturally with aging. Not to say, day in and day out, supporting clients with their very limited mobility, for example. And so long-term employees facing those situations and physical conditions are limited in what we can do. But they're still with us. My employee, I aforementioned, that lives in Fairfield, and and he calls off every month, but he's still with me because he's been with me for over 8 years and is a fantastic worker when it comes to what he can provide. We're limited. When it comes to younger employees, yes, we try our best to retain them and train them. As you said, it's so important to develop the next generation of workforce in what we do. And we have oftentimes paid complete overtime, which is time and a half, to incentivize them to work longer hours, to gain more experience. We have been paying for commute mileage and commute costs to offset commute expenses. But once they reach to a period that they have growing family, that becomes extremely difficult. Like that care manager in my office that started day one with me and worked with me for 8 years. And she has to move to Modesto because she wanted to be able to afford a house there.
Thanks. I'm going to take a brief moment here. It's 9:30. That's our scheduled time, but if Duanni and Richard could stay, we do have some more questions that people want, would want to ask. So I want to make sure that's okay with both of you, Richard.
Yeah.
And if anyone has to leave the meeting, we understand. Just a couple of brief announcements from our steering committee. Our next meeting, in case people do have to leave, our next meeting will be same time on a Friday morning on August 12th on the Los Altos housing element, what's interviewing the community, this time with Aaron Green, Director of Student and Staff Services at Los Altos School District, and John Cowan, who's the Senior Director of Government Relations and Community Partnerships from El Camino Health. If you'd like to be added to the LACC mailing list, please send an email to info@losaltoscommunitycoalition.org. That email is posted in the chat for your convenience. And I want to take this time to thank the Los Altos, Dean Miller and the Los Altos Mountain Community Foundation for providing LACC with financial and in-kind support. Next question from Marie Young.
Thanks, David. And thank you. I agree with Ann Paulson's earlier comment about this being a good focus on people that don't make six-figure incomes. And I love the suggestion that one of you, Richard or Duanni made of expanding the definition of essential workers, which I think is normally thought of as first responders, so police and fire, and teachers. What are your suggestions for changing public will so that we can get the definition of essential workers expanded to include the kinds of folks that work in your industries?
Go on, Duanni.
Thanks, Marie, for that question. And actually, my understanding is home care workers are essential workers. The reason I'm saying that is because we're considered to be the extended workforce of healthcare workers. And that was indeed listed in Governor Newsom's policy during the pandemic when it comes to essential workers have to stay on duty during the pandemic. So we did our duties, and so I consider ourselves as essential workers. But Marie, I think your point is, how do we educate the public that don't necessarily think of us as essential workers?
Right. And because I think people are comfortable with the so-called missing middle. Mm-hmm. But, yeah, a lot of the workers you're talking about are people of color, which is not so popular in our community. And they're, pretty low wage and et cetera, et cetera.
I know we're in dire needs. I call them domestic talents, and they're gold. And I think the clients that are using our services completely understand that and fully embrace that. And I hope our city officials, government officials, whoever is managing that affordable housing availability list, consider that too. That to me is the most important thing.
So we could all lobby for including these folks in the priority list on the waiting list for affordable housing. So they don't
Absolutely.
wait 5
Yeah.
to 10 years to get a place.
Absolutely, Marie. Yeah, I did bring that earlier. Thank you for emphasizing it. I really appreciate that.
Thank you.
Richard, I think you've touched a little bit on it, but if you want to expand, that would be great.
Well, I do think that many of these regulations have already defined essential workers, and they've, in fact, called them out as fire and police, etc. It needs to, in fact, include what we as a community consider to be essential services. So if home care is an essential community service, as a community, we have to recognize that and we have to lobby for that. It's the same thing if food retail is considered essential to a community. Community's got to call it out. They've got to put it right into the regulation. So I think that a lot of this has to do with just the fact that when we look at housing, it is one of the most regulated aspects of our economy. And it costs an enormous amount of extra money to build in California versus pretty much any other place in the United States. And much of this is because of layer upon layer of regulation. Many of these regulations are conflicting, where at the end of the day, it's not even a matter of trying to follow the regulation. It's a matter of, frankly, having somebody making an arbitrary decision at a bureaucratic level to say, well, we're just going to have to look past this conflict in these regulatory agencies and give you a pass. So this system as we have it is broken. And it is affecting, obviously, all of the homes that we're talking about for our essential workers. But honestly, it's affecting our ability as a state to even function. And I think that the state has to simplify these regulations. They should take a model from a state such as Utah or Texas. And I know politically this is a third rail, but at the end of the day, our regulations surrounding housing have got to be rewritten.
Thanks very much, Richard. Gary Hedden.
I imagine the answer is yes, but I want to hear your thoughts. Would your employees take advantage of housing if we did build it, affordable housing, if we did manage to build it in Los Altos? And as a measure of that, how many of them have been able to take advantage or tried to take advantage of the opportunities, say, in Mountain View?
Well, I would say absolutely they would take advantage of it. And in fact, just because of the cost of gasoline and transportation, generally speaking, being what it is. And then let's be honest, there's probably no better place to live than downtown Los Altos. I lived in Los Altos, maybe not right downtown, but I've got to tell you, I travel around and I come back to this area and I say to myself, oh my God, there's no wonder why this area is so darned expensive, but everybody wants to live here.
Great.
And have they taken advantage of the opportunities in Mountain View or been able to?
They have not, but the point is that this is always a matter of what's available when, and I have to say that, you know, they've been blocked from even having any access to this housing for so many years I think because the supply situation is changing finally and very dramatically, there is going to be more and more opportunity for them to take advantage of local housing.
Good to hear.
Duanni, anything to add to that?
Yes, absolutely. Well, thank you, Gary. I was thinking, wow, that would be a dream coming true, or to have choices in both Los Altos and Mountain View, isn't it? We're on the waiting list for 5 different places for one. And I think for the younger generation, Los Altos, Mountain View, both would be great, especially Los Altos, the access to schools, the excellent schools. My Oakland employee has mentioned that to me, Duanni, what can we do? Get my daughter, to Los Altos High, get my son to any of the elementary schools, right? And she actually grew up in East Palo Alto and went to the Menlo Atherton School District. And another factor is, Gary, I have limited knowledge, even though I tried to get the information, I wasn't able to online. And is there a cost difference? And for these units, how much are they going to be charging for rental? And that's a factor too, and I know the Oakland employee, and she pays less than $1,000 a month for her housing in Oakland, and for a family of 4. What about in Los Altos? How much is that going to cost us? And how much is a rental unit? How big is that going to be in Mountain View? Those are all the information that I hope I have some access to, right? And oftentimes when I check and it says limited, and so I seek any opportunity to educate myself with the availability and affordability.
Well, that's actually set by this. There's some regulations on the based on the median income of the area. So certain units are built with that in mind.
That's great. And I also heard in the application process with my office employee that if you're looking for a 2-bedroom units, then forget about it. And that's what Richard mentioned earlier too, the timing of it, right? So we ended up applying for 1-bedroom, but hey, it's got 4 people in the family. There's a boy and a girl as children. How long can they live in a 1-bedroom? But that dire needs is right now. And we need them right now rather than commuting and being late every day.
That's true. Thank you.
Janine Valdez.
Hi, thank you. Thanks for talking today, folks. My question, it has a little bit of a comment at the beginning, but then there is a question to the speakers. One of the challenges with the unit, the swapping units or buying credits from agency to agency, Anne has already addressed one of the factors in the chat as far as, well, now all the cities have their own RENA, so their willingness to buy more credits is there's no incentive for that because they have enough duty to fulfill. But there's this other factor with the housing elements and the state regulations, which is this concept of a affirmatively furthering fair housing. And my question to the speakers is this, assuming you know what that concept means, which means that people that are classically underserved, they need to be spread around so that they don't end up concentrated in particular areas, which tends to have a negative effect on the opportunity that these people can enjoy as they live in a particular area. If we were to have some kind of a program where cities were able to formally opt out, if you will, by using their money to do that, how do we ensure that we don't end up with these kind of highly concentrated areas of underserved people, which the downstream effects of those things, and I'll use the extreme word, ultimately they become ghettos, and that's not good for anybody. How do we, as community that are fair-minded and want to make sure that people have opportunity, how would such a system work to make sure that we do not create 2 things that are bad for communities? One, these highly overly concentrated areas that lack opportunity, and 2, urban sprawl, which is that's what's going on in Texas and Utah, is urban sprawl. We can't do that in California because we want to preserve our open spaces. So how do you suggest, maybe this question is particularly aimed at Richard, but Duanni, I'm sure you'll have ideas too. How do you solve the requirement for fair housing and fair distribution of the underserved with such a program?
Well, I think that anybody that has an opportunity to live in Los Altos, downtown Los Altos, would jump all over that opportunity. So yes, that same individual is not living in the midst of Los Altos Hills and this average of say $8 and $50 million homes. But the fact is that I can't in fact do that, and that's just the way things are. If I was in another trade, maybe a venture capitalist, I could do that. So I think what we have to do is we have to come up with solutions that are practical, and we have to come up with solutions that do solve this problem quickly. And I believe that these problems, in fact, can be addressed very quickly through regulation primarily. Again, give a developer a much straighter path in getting approved so that they can build. And then beyond that, put these affordable homes in areas that really make sense relative to existing transportation. I have to say that somebody that can't afford a car being in the middle of Los Altos Hills just somehow doesn't make sense to me. So, and I'm using that as a very extreme example, obviously, but still, I think there are practical solutions out there.
Thanks, Richard. Duanni.
And thanks, David. Richard, what you just mentioned, it's not an extreme instance when it comes to someone that cannot afford a car. And with our employees, the field employees, caregivers, companions, and there are families that share one car. And so this drastically rising transit commute cost that has really, prevented them from working in our very expensive areas. And obviously, Los Altos Hills and some areas of Woodside, those, we service our clients and are not a fit for our workers to live, for that reason. And building the housing around the mass transit is a must, in my opinion, and to provide that affordability, even with affordable housing. And on the other hand, I think the schools that we build and is a huge factor to make sure that our employee, our staff that live in this housing and have, the future for their children and to have the fair opportunity for education. And I just based on what is being planned right now, the numbers I see, I really don't see that issue yet. We have them congregated in heavily in one area because of the dire needs of how many that are in demand. And I just think any opportunity, any availability right now is just precious. And, even with our workers, and that priority is, for me, is say my office staff, if I could get a couple of them into any of these local affordable housing units, be that in Mountain View or Los Altos, I would be thrilled.
Thanks. We're gonna take one more question, and it's from Sue. The remaining hand up is from Sue Russell.
Okay, sorry, it's not really, it's more of a comment. I wanted to just respond to Gary that probably very few people get into the Mountain View housing because they have a preference for people who live or work in Mountain View. And for example, there's no Draegers in Mountain View. And I wanted to just drill down on what Marie said, because it's not a state regulation. It's our local below market rate priorities. And so there's an opportunity as the housing element comes up, if people really want to talk about not just fire, police, and teachers to request that we change that priority, include some of these other essential workers, but that's a local issue.
Thanks, Sue. I was also going to make a comment that I'm a partner in a property management company, and because we manage multifamily residential, our workers were deemed essential. And at the time, Richard, we kept going through like our industry representatives saying, why aren't the why aren't the grocery and the food purveyors also essential? Because how do people eat during COVID? That we started that sort of drumbeat during the first ordinance was March 12th of 20. And, people work in housing remained essential, but not people who were working in retail food. So it's just that this is me not talking as an individual, not as a member of the LACC steering committee. My own thought is that whatever letter to the editor, whatever letters to local council people and congressmen and congresspeople who represent everybody, we do need, and that's just my opinion, we should expand essential workers. So, and I think that's it for today. And we really thank so much Richard and Duanni for being on the panel, and everybody for coming today. It's a topic that's really important to our community and to communities throughout our state, and of course nationally too. So we're going to continue these community conversations, and we're so happy that LACC is back on track with presenting information to the community. So thanks again, everybody. Marie, I see your hand up.
Yeah, I just wanted to make sure that we thank Larry Barron, who's the one that gets these recordings onto YouTube, so everybody who didn't make it or who wants to watch again can do so. Thank you, Larry.
Thanks, and thanks everybody, and have a great Friday and a great weekend.